Discuss planning of a Limberg flap. So we will first create our defect into a rhomboid fashion. So whatever was there, we have degraded it, excised it, and now our defect is a rhomboid. Now these two angles are of 60 degrees and these two angles are of 120 degrees. So let us consider this defect as A, B, C and D. Now the dimensions of all these margins of the defect are X. The shortest dimension over here is D and B. So when we plan our Limberg flap, we extend the shortest dimensions for a distance of X. So we have reached this point, which is X. So this is also X, this is also X, and all these sides of the defect are also X. Now here we have, from this point, we have to create our flap, our Limberg flap. Now this line which we have drawn is parallel to BC, or if we go on this side, our line would be parallel to AC. So either our Limberg flap would have base coming from here or would have base coming from here, depending upon the direction or depending upon the side of the Limberg that we choose. So this is essentially our planning of the Limberg flap. Now we will see what happens when we elevate the Limberg flap. We have A, B, C and D. So this would be E over here and F over here. Now what we are going to do while elevating the Limberg flap is our incision would be like this, and like this. So this would be our Limberg flap when we elevate it. So what would happen to point B? Point B would go to point D. So this is point B. Point E would go to point A. So we would have A and E over here. Point F would go to point B. So we would have F and B over here. So this is how our Limberg flap is going to be transposed into the defect. Now let us see what happens to the suture line when we close a Limberg flap. We will again draw our defect. We know that these angles are 60, these are 120. We will not go into the details again. So we extend the shortest dimensions for a distance of X and we have created our Limberg flap. So essentially let us see how our closure is going to look like. So we start from here, here, here and like this. Any particular defect, so we have already discussed this, but just a quick word about it. So any Limberg flap or any rhomboid defect, we are going to have 4 options when we extend it through the shortest dimensions. So we will have flaps 1, 2, 3 and 4. Now which flap is the most appropriate depends mainly upon the laxity, because all these flaps are based on the laxity of the tissue in that particular area, and it also depends upon the eventual suture line, because that is going to give a aesthetic outcomes. So based on these two factors, we are going to plan our Limberg flap.